Ya estoy aquí. Okay. ¿Debemos elegir una opción de idiomas aquí? ¿Nosotros? No. ¿Sí? No les escucho.
Si quieres, Percy, o lo puedes tener apagado. Creo que no hay ningún...
No hay problema, ¿no? Está ahorita apagado, no hay problema. Para nosotros no hay problema, ¿no?
Para usted no hay problema, doctor, y tampoco
Ya.
para la doctora
Perfecto.
Paula.
Pues
Para,
está
para la audiencia, ellos pueden seleccionar uno u otro.
Perfecto.
La presentación la hacemos en español y Jody nos va a ayudar con la interpretación en inglés.
Perfecto.
So hopefully those who speak English have chosen the English. Michael, I see you there. Can you?
Sarah, you ready?
Okay. Are we ready to begin?
Excellent.
Sarah, can you hear me?
Hi, Sarah. How are you doing?
Doing well. How are you?
Fine. Well, thank you.
Thank you to both of you. We are so excited.
Thank you, Sarah.
Thank you.
Bueno, creo que podemos quizás iniciar la
I think we
sesión.
are going to begin the session. Before anything else, please remember to choose your language. If you need the English interpretation, I hope you can hear me now. We would like to say welcome to everybody here. We would also like to ask you to help us to disseminate the contents of this session with all of your colleagues. These sessions are recorded, and you can share them with any person who might be able to benefit from it. We have many opportunities to share this. Before anything else, welcome to our speakers today. It's a great pleasure to have them presenting for us today. I would also like to thank every one of you who is here today with the G4 Alliance. The object is to advocate on behalf of the rights of our patients, of access to surgery, to anesthesia, trauma care, OB care, but also what unites us is there's a benefit to bringing together all of our experiences, all of different professionals, the opportunity to know each other, to share our actions with, and to learn from all the people who very generously share. And it is where we celebrate the skills, the exceptional work of SmileTrain. We have had others in the past. We've had guests from Physicians for Peace, Operation Smile from MSI, and today we have the pleasure of having some guests from SmileTrain. We hope that many of you and your organizations also have the possibility to share your work. So I would like to say thank you to Jody, who is in the translation booth. She is the chair of the working group of Latin America and the Caribbean of the G4 Alliance. As volunteer, helps to expand our audience to English speakers. That's all for now. Please keep your microphone in mute. Except if at the end, hopefully we'll have time for some questions. And I'm going to invite the introduction of our speakers.
Thank you. Hello, everyone. Thank you all so much for being here and for supporting this speaker series to happen. Thank you to Jody for translation And thank you, of course, to our speakers for joining us here today. So I'm going to do introductions in English, and then Ruben will also follow up with introductions in Spanish and to correct my pronunciation on some things, I am sure. So first, I would like to welcome Dr. Paula Gómez. She is the Chief of Anesthesia at the National Cancer Institute, E.S.E, in Bogotá, Colombia. She is a member of Smile Train's South American Medical Advisory Council, and she is a candidate for a master's degree in medical law at the University Externado of Colombia. So thank you, Dr. Gómez. I'm also very excited to welcome Dr. Percy Rossell, plastic surgeon at the Eduardo Rebagliati, I'm sure I'm going to get corrected on that one, Hospital of ESSALUD in Lima, Peru. He is a clinical research professor at San Martín de Porres University in Lima, Peru, and an editorial board member on the Plastic Reconstructive Surgery JGO Journal and the Journal of Craniofacial Surgery. And he is the scientific director for Smile Train South American Medical Advisory Council. So thank you both so much for taking the time to be here and share your expertise. And I will pass it to Ruben to translate into Spanish introductions.
Thank you so much once again, Sarah. I do ask once again if you have your microphone open.
Si tienen su micrófono abierto, por favor, póngalo en mute. Please put your microphone on mute if you have it open. Please silence your audio so that we don't have interference.
Una grata bienvenida a la doctora Paula Gómez, que es la jefa de anestesia del Instituto Nacional de Cancerología en Bogotá, Colombia, y parte del equipo de Consejo Médico de Smile Train para América.
So he is repeating the introduction in Spanish.
Mencionar que la doctora está en proceso de adquirir su grado en medicina legal. Y también damos una grata bienvenida al doctor Percy Rossell, que es un cirujano plástico en el Hospital ESSALUD de Lima, Perú, alguien que ha estado en el medio atendiendo pacientes con condiciones craneofaciales por mucho tiempo, con una trayectoria muy amplia. Él es profesor de la Universidad de San Martín de Porres y también miembro de editorial del...
Ruben, your Spanish is coming in on the English track.
Right-hand side panel, when they were given exogenous angiotensin II, they actually survival.
¿Eso es mejor?
For
¿Es
the
better?
moment, anemia is not unknown to us. It's part of a lot
Dan, I didn't translate it into English because Sarah had already said it in English. So I think it was just going to both.
Ok, perfect. Y es también director científico del Consejo Médico de Smile Train para América del Sur. Doctora Gómez y doctor Rossell, bienvenidos y muchísimas gracias por compartir con nosotros el día de hoy.
So thank you again and for being here with us today. Thank you to both of you for inviting us, for showcasing our region and allowing us to contribute our knowledge to contribute to this noble cause that brings us all together in the entire planet right now. Thank you again for the invitation. Shall I begin? Who's going to begin?
Doctor Rossell, su micrófono está cerrado.
Perdón, sí. No, Paula, por favor, puedes iniciar tú.
Doctora Paula, you can begin. Thank you. I have a PowerPoint here I'd like to share. Give me a second just to set it up.
Can you see my screen?
And yes, we can see your screen.
Sí, doctora, la vemos.
Okay. Cuando estábamos planeando
When we were planning this meeting, this conference with the G4 Alliance, we were told that most of you are I may not have may not be medical people. So we created something that would be available, accessible to everyone, even non-doctors. And sometimes it's very difficult when you're not a doctor. So I am going to communicate a message related to the work I do in Smile Train, related to advocating to protect the right to health in regions like ours, where the needs are perhaps more visible than elsewhere. I would like to open the talk talking a little about global surgery and anesthesia as a right, part of the right to health that we are all have as humans. It's a term that has been adopted for this so that we doctors have a multidisciplinary approach in all systems throughout the world, in all health systems, so that there is access and availability for everyone, so that these health programs should be based on quality of care that we can offer as professionals, as medical professionals. Of course, when we talk about these themes, we talk about the challenges for patients. The challenges faced by patients related to security and day-to-day work that we see.
Bien lo hace el G4 en la protección.
As the G4 does in protecting this part of health needs. We talk about the surgical solutions to address thousands of illnesses and reduce morbidity and mortality.
Gracias. Ay, pueden cerrar los micrófonos, por favor, que es que se nos mezcla y es difícil un poco.
Please silence your audio. What we see in regions like ours and in others, in other countries, and in the African continent as well, other countries that suffer that are stigmatized, the difficult access of the majority of patients to a safe surgery and anesthesia. The fact that we live in areas that are stigmatized, the increased mortality in our populations. Worldwide, the statistics our patients are the ones who pay the price in our systems.
Hablando general de cifras.
Now, speaking in general terms, what the research shows there are more than 230 million surgeries a year, but less than 4% are in developing regions. Latin America or regions of Africa or Asia. Approximately 2 billion people in the world have no access to surgery to address their illnesses. And millions of these patients in this region have very unsafe anesthesia conditions. We have many problems related to this lacking care. A big challenge is the lack of workforce in our countries. For example, in Africa, there might be fewer than one anesthesiologist for 1 million patients. Infrastructure is lacking. The facilities, the equipment and materials are all lacking in these geographic regions. Also, lack of transportation can make it difficult to access equipment and materials. And also, there may be very limited control of pharmaceuticals, and that can also make the care more difficult. When we talk specifically about anesthesia, many lay people don't really understand how important anesthesia is. It is actually a very young science, dating to 1846. 2 years later, we discovered that there was a certain level of mortality. They didn't have the technology that we have now. The first professionals really started to specialize in anesthesiology in the University of Wisconsin. Once this formal education began, and anesthesia became recognized as an important subspecialty, mortality started to reduce significantly related to anesthesia. So they realized that 60% of the deaths that had been happening related to surgery were related to the anesthesia care. So by addressing the security, the safety aspect of anesthesia, began to gain more focus. So now we have research that have demonstrated how the safety level of modern anesthesia, reducing the number of deaths related to anesthesia. As the decades have progressed, thanks to the development of the medical field in anesthesia, this aspect of surgery has become much more manageable.
Es así como hoy en día.
So now, today,
en la última década del siglo XX,
so in the last decade of the past century, there were still 34 deaths per million of individuals.
Y que estaban relacionados sus muertes al solo el acto anestésico. ¿Y cuál es el problema real que tenemos con la anestesia?
So what is the real problem with anesthesia? Why is it so important?
Que es la cura para alguna enfermedad.
So surgery is the cure for many illnesses. But anesthesia is intrinsically dangerous, and it's not intrinsically the treatment. So it brings in an element of danger. So that's why this specialty is so vulnerable and so important to focus on.
Teniendo ese escenario previo que teníamos,
given that previous scenario,
si tenemos o no tenemos un nuevo escenario con lo que está pasando, hacemos una pregunta y se las hago a todos.
Now we ask ourselves a question and we pose this question. Is there a new scenario now that we are doing this work amid a pandemic?
En estas últimas diapositivas yo creo que vamos
In these last slides, we're going to address that.
Y vamos a mirar unas posibles soluciones.
And we're going to look at some possible questions.
Y creo que puede que haya un nuevo escenario, sí, pero ese escenario es un poco diferente.
So this scenario is a little different now.
Ha cambiado en mucho cuando miramos hacia atrás. Solamente que nos está añadiendo un nuevo personaje que es el causante de esta pandemia, el coronavirus.
So we're adding to the scenario of anesthesia this new character, the pandemic.
Por mantener todas estas campañas y toda esta orientación y todos estos grupos trabajando por estos objetivos.
So how do we keep everybody who's working, everybody in the G4 Alliance who's working to provide surgery, how do we keep people working? But are we setting aside many of the objectives that we established in the past?
La respuesta a esto que está pasando
debe ser to this, we need to refocus on basic human rights, including the right to health.
Donde nos hablan de la salud
como a fundamental right. The right to health is a fundamental right of all.
Y donde vuelven y nos indican cómo inclusive la cirugía global como parte de la atención prioritaria en salud.
To refocus on what is global surgery, what is its role in assuring the right to health throughout the planet.
A la atención quirúrgica esencial y a los servicios de anestesia para que cuando
anesthesia services
conservados por todos los sistemas de salud se pueda llegar
a be maintained in all health systems.
Que es lo que buscamos y uno de los
This is what we're looking for.
El G4 Alliance y otros muchos grupos como el Alianza,
like many groups are aiming for, like the G4 Alliance, the WHO.
Creo que a medida que avanzamos vemos como
as we advance, we see the obstacles that are mounting, making it more difficult to achieve this objective in the face of the pandemic for obvious reasons, but have been added on to the challenges that already existed.
Y cuando hablamos de nuevas pandemias
and we talk about this new pandemic and new challenges and the new accumulation of challenges,
es volver a esto, al olvido de esas cirugías que tenemos relegadas en los sistemas de salud.
We come back to all the neglected surgeries, the surgeries that aren't happening. How do we continue to address them rather than letting them still be waiting for their surgery?
De esta parte, sobre todo de la parte del mundo donde más estigmatización tenemos.
So how do we continue to provide surgery in the areas of the world that are stigmatized? And how do we make their needs continually visible and improve the access, the quality of surgery, make their needs visible and addressed as they are in the first world? Many patients, they're undermining their own economy because they don't have surgery.
Acá solamente para mostrarles de nuevo
Here, just to show you again,
muchas de las enfermedades quirúrgicas.
some of the illnesses that are very vulnerable to being neglected,
Y lo que hacemos
and to focus a little on what we do.
y parte de otro acúmulo de problemas sigue
And
siendo
this is part of another accumulation of problems.
desde otros puntos de vista, porque seguimos dejando poblaciones vulnerables
We
aparte.
are continuing to leave in abandonment many
Los niños y la
parts of our
atención,
population.
donde por ejemplo en el último Congreso Europeo
For
se habló
example, in the last
especial
European
por el
Congress,
donde los niños merecen ser atendidos por profesionales idóneos.
we talked about the rights of children to be to receive surgery from qualified professionals and the challenges of violent obstetric violence that we see throughout the world.
La pandemia que se viene
The pandemic,
cuántos pacientes de cáncer hemos dejado de atender porque
many cancer patients have not been treated also because of the pandemic.
de esta nueva enfermedad, pero a la vez estamos minando el derecho a la salud.
But through all of this, we're undermining the right to health of all these populations.
Y por supuesto ni hablar
And of course,
del compromiso mental que estamos creando y de lo que se nos viene a nivel de salud mental, sobre todo en
the
nuestros
mental health
creo que han sido poblaciones
issues that are emerging in our regions,
que
the additional mental health suffering.
Con esto quiero mostrarles
I'd like to show you here which parts of the political and civil human rights
fundamentales
cover the fundamental rights to health.
cuando la salud
a torvastatina para
está
120
Disculpe, doctora.
días.
Arelis, ¿será posible cerrar el micrófono, por favor?
Gracias. Se puede entonces derogar nuestro acceso a derechos fundamentales cuando la salud como bien pública está en peligro, y es lo que estamos viendo.
So
¿Qué pasa en el día?
with the right to health in such great danger, what are we doing to protect the human rights?
El principal derecho fundamental que
The
estamos
primary human right that is undermined is the right to health. Despite our efforts to support global surgery, but we are stigmatizing and harming even worse the most vulnerable populations. And the need for care of this world of illnesses that require surgical care. If we look at this slide, we can see how over history, there have been many pandemics. This isn't the first one. But when we look through the literature, we can see the Black Plague, the first flu pandemic in 1820. We can think about the AIDS pandemic. When we review the literature, when we look at public health, is there any difference with how we're addressing these pandemics today? The first flu pandemic in 1820, we saw many of the same things we're seeing repeated today. That doesn't speak well. We're doing something wrong. Why are our solutions continually failing? And in the end, do we see any light of hope? And it brings out the work of science. But as you can see on the lower part, you can see the distribution of the vaccines. The distribution of safe surgery.
Los que más acceso tienen y la que tiende más al vino tinto, lo que menos acceso tiene. No
Those
sé
in the
si
dark colors have less access to surgery. The light colors is those who have more access to surgery. And speaking of the vaccine, which is our ray of light, of hope, but the distribution is about the same.
Y no hay que dejar de lado, por supuesto,
And we should not forget all of the institutions that are supporting health policies and who continue to struggle so that the most vulnerable patients have access to surgery and safe anesthesia. That is what I had hoped to share with you today.
Doctora, muchísimas gracias. Realmente impresionante. Hay mucho para discutir con esta ponencia, perdón,
Thank you, Doctor. There's so much to share. And there's so much to reflect upon together. Now I'd like to invite Dr. Percy to continue. I'm sure there will be questions at the end, so please stay with us, Doctor. Hopefully at the end we'll have time for questions. Thank you very much. Good afternoon. For some of you, good evening. Thank you so much for this opportunity, for this invitation, this opportunity to share through Smile Train, who gave us the invitation. Paula, could you please close your presentation so that I can share my screen?
Sí, porque hay que finalizar la presentación de pantalla, Paula, para poder presentar la mía. Ajá, a ver. Ahí está, gracias. Perfecto.
Alguien por ahí tiene un micrófono abierto también. Si pueden cerrarlo, por favor.
If anyone has an open microphone, please mute your microphone. Can everyone see? Yes. Yes, we can see. Thank you. Thank you very much. First, again, to thank you for this opportunity to present on this topic that is important for all of us. And I think the important thing for those of us here today is what are some responses to all the questions we have about how do we confront the situation of specifically how to provide cleft lip and palate surgery amid the pandemic. How do we find a path to move forward? Dr. Paula focused a little on how the pandemic is affecting medical care in general for populations that already are vulnerable and how it's going to affect us long term. I'm going to try to focus on some answers to these questions that we all have right now. We hope to find some answers.
Una breve introducción,
As a brief introduction, of course, this is a new illness. It belongs to the family of virus, but it became a new pathology and has become a great challenge for the world. The symptoms, of course, it was originally thought to be respiratory. Now we know that it is an illness that affects multiple organs. And it has not just short-term effects, but medium and long-term effects. We've discovered, we're constantly discovering new symptoms, some much more serious than others. The nature of this pandemic is much more serious than originally thought. And the conditions of the patients are affected differently given their risk factors.
En la misma enfermedad, sino en cada persona con una condición individual propia de
Each
ella.
person who acquires this illness, according to their own conditions, presents a different illness. We need to begin to understand the pandemic as many parallel pandemics developing individually in different regions. Each country, we can even begin to start about different realities among different cities in different countries. So there are many different states and statuses of the pandemic. The prescriptions that we might apply, the treatments that we might apply in one place might need to be adapted to every different reality. To address this problem, there are more and more specific realities in each community.
Ya esta información que es de los inicios de la pandemia.
Information that comes from when the pandemic just began talked about how the illness would appear in the children, and taking into account the number of patients under 17 years old in the US, the number of severe cases that were projected, pediatric cases.
Y estamos hablando de los Estados Unidos.
And treatment might be insufficient. And here we're even talking about the United States. But the reality in our Latin American countries is much more disadvantaged. To what degree does the scenario of the health systems in Latin America be prepared for a crisis of this type? We all understand that we were never prepared for this. No country in the world was prepared for this. But in Latin America, we're even less prepared than other countries. And one thing that we are observing in the second wave of illness is that the condition of our health systems is very critical, and it was before the pandemic. We need to understand this well. The nature of this illness among children, which is the population, because we're talking about the children who are affected with cleft lip and palate, they are presenting COVID-19 differently. They often have digestive issues, and they have multisystemic inflammatory disease, similar to Kawasaki disease. Systemic inflammatory disease, and it seems to be caused by COVID.
De la enfermedad se hacen en base a los test que todos conocemos, ¿no?
The diagnosis of COVID is through of course, the test that we all know, the PCR, the antibody tests, and more recently, the antigen tests, which have become important elements to determine the condition of our patients preoperatively, and also to manage them post-op. In some cases, the tests, the pre-op tests that we require of all patients, they often identify antigens.
Si podemos, por favor, gracias. Si podemos saber ese micrófono, por favor. Gracias. La presencia de anticuerpos IgM.
So the presence of antibodies, IgM, is going to require us then to defer the surgery. But if we find antibodies IgG that indicate a previous infection, they are not a contraindication for surgery. But of course, if it's PCR positive,
ya de inicios de la pandemia se había
at the
reportado
beginning of the pandemic, there were a series of complications around surgeries. The initial reports were very dramatic. There were cases where an entire surgical team caught COVID-19 because of surgery, during the surgery, when the patients were infected. Everyone involved in their treatment, and there were even some deaths. This situation was demonstrating. Natalie, is it possible to turn off everybody's microphones? Could we please ask everyone to turn off your audio? This scenario was showing the risks.
En China estos reportes fueron muy importantes para tomar precaución de lo que parecía ser, ¿no? Un escenario que se nos avisoraba, ¿no?
So we were seeing this initially from China. So surgeries who underwent surgery, they were able to document complications among patients that were operated who had COVID. And you can see here, for example, we saw elective versus emergency surgeries. The mortality level, almost 20% mortality rate at 30 days among elective surgeries, and 25% of patients with COVID suffered mortality within 30 days. Often these were pulmonary complications. A similar number of those 42%, whether it was elective or emergency surgeries, were suffering pneumonia. So surgeries should be either canceled or postponed. Given the possibility of complication among these patients, including fatal complications. And there was a lot of fear among the doctors and nurses. They were very afraid to perform surgery at the time. Here we can see some of the clinical care.
Que estaban en periodo de incubación. Observen ustedes acá, desde la admisión, ¿no? Esto es el tiempo, ¿no? Observen ustedes la cirugía, totalidad. Este es un estudio.
You can see here the appearance of the first symptoms of those who underwent surgery. 9.5% had their first symptoms. 100% of the patients had symptoms at 9 days out post-op. At 11 days, at 16 days out, many had acute respiratory distress. And a high percentage, 20%, died within 20 days. These are the results. This is the data that was observed. So this is another reason why they promoted canceling elective surgeries. So the planet practically closed their ORs for elective surgery. They closed their ORs. That was the initial measure that was taken. There was a little more flexibility in terms of cancer surgeries. And in obstetric surgery, clearly, these are not surgeries that could be canceled or postponed. It was necessary to do them. They had to continue. As you can see, this is a graph that represents the number of elective surgeries that were canceled. You can see that in Europe and Asia, Central Asia, the high number of surgeries that were canceled. In all the different regions, you can see the number of surgeries that were canceled in red in the different regions. But a smaller proportion of surgeries were canceled in Africa and other regions. So they decided in many countries that all elective surgeries should be canceled until the pandemic was under control. In this sense, but it wasn't under control when they started again. So they tried to develop guidelines for when surgeries could start again. What are the indicators? And these are the indicators that we are using. And this data has helped us to identify when we can give the green light to certain types of surgery. This is the data from the American Cleft Palate and Craniofacial Association. They discovered that oral surgery has very high risk for COVID-19 transmission. And the safety and security of both patients and medical teams is the priority. And since cleft lip and palate surgery are considered elective surgery, it has been decided that because these surgeries can be performed at any age, they can be postponed. In the case of gradual treatment surgeries, we have decided that it's to avoid permanent side effects. But we think that these surgeries should be undertaken before age 2 to avoid greater damages. Fortunately, telehealth possibilities were already very developed in the developed world. And this has become an important element to be able to continue to provide care, including post-op care for patients who have previously been operated. For all the multidisciplinary care that patients continue to need, including in dental care. So this has all been incorporated by SmileTrain. SmileTrain has developed a series of programs, telehealth programs, and they've been very effective. Here you can see, for example, publications about these experiences. Here it's important to highlight the scientific progress for Latin America, where there are few universities or medical centers that so medical publication has become just a very necessary element for us to be looking at the different realities in the different countries that each has their own characteristics and their own they all need their own tools and measures. Sometimes the solutions in one region are not applicable elsewhere. What they do in the US may not be applicable in Latin America. So having our own publication is very important. We need to be able to share our experiences so that we can learn and apply our solutions. We need to continue to transmit and making these treatments available to the population. This continues to be an ethical topic. Another issue that has become an ethical imperative is the distribution of vaccines, COVID-19 vaccines. In the meantime, we need to continue to emphasize the protective measures for patients and for the whole population. To conclude, I'd like to emphasize a few points. First of all, we need to understand that there's not one pandemic. It's not one sole pandemic. Every city, every country has a different health system and has a different reality in how the pandemic is affecting it. Whether or not you can proceed with elective surgeries will depend from city to city. In my country, for example, in Lima, Peru, our surgical conditions are very precarious. So almost all healthcare has had to focus on addressing the pandemic. In my hospital, almost 90% of my hospital is full of COVID patients. And in these conditions, we can't be providing surgery. The exception is to provide surgery we also have to think about the range of transmission of the illness. In December last year, we had a very low level of transmission. We had gone from having 200 persons dying a day down to less than 40. That created a scenario where it was possible to begin to perform surgery for patients who, even if some patients, it was perhaps elective, but it was becoming urgent that they have surgery. So it was an ideal scenario. In December to January, we were able to operate more than 100 patients with satisfactory outcomes, both in the surgical aspect and in non-surgical aspects, with very low percentage of COVID infections, using very careful developed protection protocols. And we are publishing about how we did this. So we can do palate and cleft lip surgery amid the pandemic. Yes, we can, but it depends on the scenario in every place. The priority continues to be addressing the pandemic. It is very clear that we need to be watching out for the safety of both the patients and the medical staff. But when the system is collapsing, when we're going to need to be taking patients with a complication to the ICU, then we need to put off that surgery. We need to keep a close eye on the waves of the trend of infection. When we see infection rates lower again, we can safely resume surgery, like we did in these past 2 months. But now we've had to stop surgery because now we're amid the second wave of infections. We're back up to 150 or so deaths due to COVID per day in Peru. I think this experience that I'm sharing, I hope can be helpful as tools to apply to other locations in Latin America. I will sign off there. Once again, thank you to Smile Train, to the G4 Alliance. Thank you for letting me share this experience. And I would welcome your questions.
Se nos va muy rápido cuando estamos disfrutando.
Unfortunately, the time goes by very quickly. Thank you, Dr. Gómez and Dr. Rossell. And there are many reactions. What was striking to me was Dr. Gómez's message about the rights of patients. How we need to continue to look at the inequities in healthcare and how do we continue to fulfill the rights of the population and the search for solutions in each individual context. Now, colleagues, if we could open up our microphones.
Estamos ya casi a la hora, pero si nos dan unos...
We're almost at 5 o'clock, but we have maybe 5 extra minutes. If there's any questions.
¿Una pregunta?
Does anyone have any questions? Natalie, you might have to unmute.
Quisiera agradecer a la doctora Paula Gómez y al doctor Percy Rossell por su magnífica...
I would like to thank Dr. Gómez and Dr. Rossell, members of our South American Advisory Board of Smile Train. Thank you very much. My pleasure.
Gracias a ustedes.
Diana es toda sonrisas, está muy alegre y orgullosa, obviamente.
Me encanta mi socio, soy súper orgullosa.
Diana is very proud of her colleagues, Smile Train colleagues.
De repente alguien se anima a hacer las preguntas.
In the meantime, perhaps we could complement a few comments. One of the more used models in Latin America to provide cleft lip and palate surgery is through surgical campaigns. In this scenario right now, it's impossible to do these campaigns. We may have to start to think about new models. How do we strengthen our reference hospitals, referral hospitals? Maybe we could envision in a medium future, it's going to be very important to find new models of how to provide these surgeries. Yes, it's a very important topic. Any thoughts on this?
Percy, mi colega, por supuesto, y juntos del SAMAC, yo pienso...
Personally, I agree with Dr. Percy, but many times
es la falta de mantener los programas y darles continuidad. Eso hace que las
a lot of times the problem is we're unable to maintain programs and provide continuity.
En nuestras áreas que son un poco difíciles, no se adapten o no se queden en ciertas zonas que lo necesitan, ¿sí?
Sometimes the offerings of surgery are only available in certain areas.
Que creo que los latinoamericanos lo vemos en nuestro día a día.
We see this day to day in Latin America.
Lo vemos y creo que Percy también ha hecho parte de estas misiones tanto como yo. De repente estas se
we've been a part of these surgical missions. For many patients, their only chance to access surgical care is through these missions or campaigns.
Es parte de esa dinámica que nuestros países y nuestros sistemas de salud.
Part of the dynamic in our countries.
Entonces, muchas veces esta es la válvula de escape.
A lot of times this escape valve provided by campaigns
y defienden el derecho a la salud de
And
estos pacientes.
we depend on the work of organizations that support and defend
Ese servicio llegará a esas poblaciones.
and to help provide these services for these populations. Thank you so much for your comments. There's a lot that we could talk about. It's important to find the ideal scenarios, the ideal centers.
Olvidar a que las personas que tienen muy poco acceso.
But we can't forget that many patients who have very limited access, there has to be a solution for them. And we need to look for the ideal scenarios involving, referral centers where we can always send patients. But we need to continually look for varied solutions for all patients. We need to continue to expand and create more capacity. But the pandemic has definitely highlighted the need to strengthen local capacities.
Claro, yo creo que acá habría que puntualizar tres cosas.
I think it's important to highlight 3 points. We have to understand, sometimes we think about developing models of surgical campaigns. We think about them with elective surgeries or outpatient surgeries, but the patients we serve, the populations we serve are very vulnerable. And working in the scenario of the pandemic isn't going to be for just 6 months or another year. Even though there's a need to address, to treat a lot of people, it may not be through massive campaigns of providing surgery. This is an opportunity to develop research. It's an excellent opportunity to develop medicine. So these crises sometimes provide good things. They challenge us. And they're going to make us grow. Any other questions from the audience?
Estoy en el estado Zulia, un estado límite con Colombia. En realidad nosotros habíamos suspendido durante un tiempo las operaciones por la situación de la pandemia, sobre todo por desinformación, yo diría, de más contaminación, menos contaminación, de complicaciones. En realidad no hemos tenido complicaciones en niños con pandemia. Yo manejaba la unidad de quemados también y sí, me contaminé tratando a un paciente quemado. Eso hizo que tuve que suspender la cirugía. Pero la idea del doctor Percy y la doctora Paula, estamos de acuerdo. Todo se puede hacer si se toma en cuenta todas esas medidas profilácticas. Pero sí es importante que hayan centros. Yo estoy trabajando ahorita en una unidad pediátrica que hemos ido recuperándola poco a poco, que no tratamos COVID. No hay pacientes COVID. Entonces, podemos seleccionar al paciente en la consulta preoperatoria. El día de la cirugía, llega el paciente muy temprano, se le hace la prueba de hemoglobina y si sale la IgM positiva.
Sorry, I've been unable to understand him sufficiently to translate.
Los niños que hemos operado. Pero sí seleccionamos muy bien los niños y para mí, pienso que hay algo muy prioritario. Considero que tenemos que vigilar muy bien dónde se vayan a operar esos niños. Porque yo siempre digo que ya el tener un niño con una malformación congénita es una mala suerte. Pero es mayor la mala suerte si es operado por una persona en unas jornadas de esas donde no están preparados para la operación y con esta crisis que tiene el país es más grave todavía porque se puede complicar al paciente por no seleccionar bien.
I apologize, I can't follow the accent.
Como dicen ustedes y los felicito. Gracias por la invitación. Muy poco a poco, pero tenemos que dar tranquilidad a las madres que tienen un niño de 6 meses con un labio hundido, que no lo está sacando a ninguna parte porque a ella le da vergüenza, no quiere que vean a su niño mal formado y debemos solucionarlo. Y sobre todo lo que dice Perry, paciente que ya tiene 3 años, que no se ha operado, está comenzando a hablar, es necesario operar su paladar. O sea, no es una enfermedad grave, pero sí tiene su efecto psicológico muy importante en la familia, en el familiar, que tenemos que abordar, saber abordar muy bien y tenemos que hacerlo directamente, tomando todas las precauciones que estamos diciendo que tenemos que tener. Nosotros tenemos todas las medidas de bioseguridad, tenemos nuestros batas, nuestros protectores frontal.
So the essence of what the doctor is sharing is that in his region of very vulnerable patients, the psychological effects of not being able to operate for cleft palate and cleft lip are very serious. And fortunately, they've been able to operate, keep COVID out of their hospital. And if the conditions are right, they've had to just continue to work. But we are also, there's a accumulation of cases, cancer surgeries that are being postponed.
Encantado de saludarlo de nuevo. Sabe dónde estoy ubicado, en Venezuela. Cualquier paciente que necesita ser operado, si puede trasladarlo hacia Maracaibo, yo lo opero con mucho gusto, con todas las normas que tenemos.
We are receiving patients who need surgery, patients who are crossing over from Venezuela. Any patient that is needing surgery, we are evaluating. Quite often we speak of elective surgery, but patients need these surgeries. We can't tell them to wait for many of these surgeries, even though they're so-called elective, but they often cannot be postponed. We need to find solutions. We need to remember that the patients have a right to health care. We have to continue to treat patients. The vaccine is going to arrive to us not for a long time. We need to continue to care for patients. I congratulate the doctor for their very brave insistence to continue to provide care. It's very important to share these experiences, to publish them and share them. We, for example, we've shown how using the PCR test 36 hours before their surgery and the day before, the family members as well, we test their antibodies, and we operate in a health center that does not have COVID patients, and we are doing tests every week. And if there are symptoms with PCR tests, the patients are monitored in the pediatric consults that we can't do it by telehealth. The patient has to be there. And sometimes we will have the patient in the hospital for just one night in order to have a little more precise control of them for the 24 hours. So it's an entire protocol that we've developed to be able to operate safely amid COVID. And we're publishing this very soon to share this experience. So there are a lot of good lessons for us to share. And there are protocols that are giving good results. We have operated more than 100 patients using these protocols without complications and with a very low percentage of infections. I think it is really good to share these experiences.
No, esta atención de los pacientes se hizo de forma privada.
This patient care is being done privately because the public system in Peru is completely collapsed. It's almost totally focused on COVID patients, patients who have complications from COVID. So we can't provide care. The government can't provide other care. If you look at our waiting list, it's more than 250 patients. In December, we had more than 250 patients on a waiting list. And so we had to do these surgeries in private practice, so that in a private hospital, so that we could do the protocols that were needed. Obviously, the low-income people are on the margin of this care. This is going to be a very interesting scenario to develop protocols. But the problem is low-income individuals are unable to access this care. But these are experiences that are going to serve all of us.
Doctora Estudillo, muy bien.
Sí, ¿cómo está? Me presento, soy Andrea Estudillo, otorrinolaringóloga de Cuenca.
I am an ENT from Ecuador. I'm very grateful to Smile Train for the support they provide us. I wanted to share a little bit of our experience in Ecuador. We have very few resources. Our hospitals are collapsed. We have always carried out these surgeries in private hospitals. Of course, we pay for the expenses. So number one, in order for us to resume surgery, we did a few patients and we have just started organizing diagnosis. But then we did a few surgeries in May, but then we had to stop because it was the high rate of infection. But now we're operating again. We didn't have a volume of 100 patients like Dr. Percy, but we have some. We are currently operating patients from the entire country. Many have had to travel more than 15 hours by bus just to get their surgery. But it's impossible for us to access the PCR test. The government, we can't get it through the state. There's no way to get access to it at no cost. What we have done first is we've been able to access rapid tests, and I have my private consult office. So I have been able to verify the rapid tests and with a high standard of, because a lot of the tests that are available in my country are very low or not very reliable. So what we do is patients who are close to us before their surgery, we have them come in every week and we do a rapid test, not only to the child, but to their family members, parents, or caretakers. We do that for 3 weeks. And on the day of the surgery, we do the test again. And so we're testing the whole family community for at least 3 weeks. The antigen test just arrived to our country in December, but we do that now. So we do the serology and the new test the day of the surgery.
No después, es decir, el paciente debe, si el paciente tuvo un contacto 14 días
so
antes.
For the antigen test doesn't detect if they had, only detects if they caught the infection in the past week. So this is how we diagnose our patients and make sure they have a safe surgery. Safe for them and for us as doctors. We have been able to do this with the support from Diane of Smile Train.
hacer con PCR, pero
but we can't do PCR.
con el apoyo de Smile Train tratamos de
But with the support from Smile Train, we've been able to take advantage of other tests. The other thing, we've been talking very seriously about the family members, about the risks of contagion.
En todos los hospitales podemos tener un paciente COVID infiltrado o un personal de salud ahí. El día de hoy creo que hemos realizado aproximadamente 40 cirugías. No hemos tenido
To date, we have done about 40 surgeries.
Hemos operado pacientes con IgG positiva.
We have operated tests with previous infection, but now negative and without complications.
Nosotros los vigilamos por el riesgo de sangrado, dificultad respiratoria.
And we keep our patients in the hospital for 24 hours because of the high risk of complications. And Smile Train is also supporting us to have lodging, safe lodging, to keep family members isolated for 24 hours. So that the patients and their families can be here in the city, those who travel from elsewhere, so they can be here and isolated to be able to do their visits. So these are good options for countries that don't have high resources and who don't have the PCR tests available. And this has allowed us to continue to take advantage of all the help that we have from Smile Train in our city. That is what I wanted to share. We've gone 15 minutes beyond the time, but it's so exciting to hear all of these experiences. These things matter to us.
Que es nuestro líder del equipo de América Latina, la Alianza E.S.E, a lo mejor podríamos organizar otra sesión de seguimiento.
Maybe we can organize another follow-up session and maybe invite people to share their experiences more openly. What are the challenges that people are seeing in their different countries, and what are some solutions that people are finding? There's so much that we can share when we share our different experiences, and there's so much we can learn. There are many of us who are trying day after day, because surgery is important, and it's important today. So I'd like to ask all of you the favor. If you have a protocol of how you're doing surgery amid COVID, write to us. Send us your email through chat. We would like to schedule a follow-up session. This pandemic is going to be with us for a long time. All of these challenges, we can face them sharing among ourselves. It's now 20 after the hour. There's so much interest. But let's give one final opportunity for somebody to share a question for our panelists.
Para complementar tus comentarios, claro que sí.
Just to complement your comments, yes, I'd like to have a follow-up session. Let's schedule it. Many of our different colleagues are here today. We'd like to hear their experiences in a follow-up session. It's a wonderful opportunity, all the people who have signed on today. I can't remember all the names, but we have 60 people here today, so there are so many colleagues from Smile Train. What we have tried to do is help our different partners to access the tests, both for the patients and for family members, access PCR tests. and find ways to continue to serve our patients.
Pero claro que sí estamos llenos a compartir toda esta información, cómo lo vamos haciendo.
Let's continue to find ways to share all this information.
Entonces, lo que vamos a hacer, Diana, es sentar una fecha.
Let's establish, we'll schedule a date for a follow-up session.
Es muy provechoso. Tenemos la experiencia de Smart Train, está acá Puente de Solidaridad.
Here we have Solidarity Bridge, we have Smile Train.
Está Operation Smile, está la Sociedad Mexicana del Paladar Hendido, hay muchísimos colegas.
And we have lots of other associations and participants here. It's something to celebrate.
Dr. Rossell y doctora Gómez, ¿algún comentario antes de cerrar? A medida que le damos...
Dr. Rossell and Dr. Gómez, would you like to have a final comment? This situation is going to be with us for a long time. In the history of vaccinations, when we look back, the vaccination is
O sea, la pandemia está pasando, ¿sí? Pero a su vez de que esto está pasando y más o menos nosotros tenemos parte de nuestra vida detenida, este tipo de enfermedades no se van a detener, el cáncer no va a parar. Las enfermedades
this pandemic will eventually be under control, but other illnesses that our populations are suffering, cancer, they are going to continue. And all these populations now are even more stigmatized and more vulnerable because of the pandemic. The vaccine is a light of hope.
Prevención de la enfermedad. La vacuna lo que va a hacer es que ninguno de nosotros tengamos enfermedad grave, que nuestra sintomatología
We have to remember that the vaccine, it may not prevent entirely the infection. It will reduce the gravity of our illnesses.
Y tenemos que aterrizarnos en eso y poder buscar soluciones.
And we need to continue to find solutions to continue to increase access to healthcare as a human right.
Eso nomás será mi mensaje.
Excelentes palabras para cierre, doctor Rossell.
Bueno, finalizando, agradeciendo nuevamente la
To
oportunidad.
finalize, again, it's a pleasure to be here. I agree with Paula. This is an illness that COVID, it's not going to go away soon. It's going to take time.
Si algo ha quedado muy...
If there's one thing that has become very, very clear, is that our healthcare systems are deficient. We have to do something to improve them. We have to reflect on the needs that exist, the limitations that have been around for a long time in every country in Latin America. This is an opportunity to start to develop new visions of how to provide quality, visionary medical care. And exploring areas that we have not been focusing sufficiently on in Latin America. Now, even the journalists are talking about the importance of scientific research. We need to really be sitting down and writing and sharing and communicating among ourselves as professionals. We have not done this sufficiently in Latin America. We need to strengthen our own medicine. And this medical research is an important element to provide high quality medical care for our patients. We're going to have to adapt. We have to, like we're doing today, we're going to have to come together and share and learn about each of our realities. So those are my closing comments.
Bueno, queridos amigos, nuevamente muchísimas gracias por su tiempo.
Thank you again to everyone for your time. especially for our speakers today. There's a lot for us to think about, a lot of work to do. And there are so many people in this forum who are putting at the forefront the service for the population that needs it and the care that we can provide. It's a privilege to be a part of your lives and to find solutions together. Continue to be part of these sessions as part of, this is a forum, a Latin American forum of the G4 Alliance, where we're focusing on the needs of our patients.
Muchas gracias por tu liderazgo y tus excelentes traducciones también. A todos les deseamos una muy linda resto del día.
Have a great day, the rest of your day. Thank you to everyone. Enjoy. Greetings to your teams and to your families.
Thank you.
Good night, everyone. Thank you so much. Greetings to everyone.
Gracias. Saludos, Dan.
Paula. Gusto verlos.
Todo tiene un límite, cariño. Si al menos se tratase de una aventura sin importancia. Pero es como un pantano en el que te estás hundiendo y eso no lo soporto.